Hello, my name is Fiona Wise. I'm the Executive Chair of Bob STP. Well, the aim of this is to make sure that we have a comprehensive workforce that meets the needs of the population, because actually the quality of the services that we provide are only as good as our workforce. And we know that it's quite difficult to attract workforce, not least because of the cost of housing in this area. So we need to develop strategies so that we complement each other but not compete for the same workforce. And we need to try and offer same standards in terms of condition of employment, so staff feel they're being treated fairly as well. In terms of patients or outcomes for patients, I mean, a key responsibility of the programme is to share learning and best practice. So what works in one place, can that work in another place? So what we will be aiming to do is to find ways to increase our ability to keep people at home, to avoid hospital admission, plan more capacity, as I've already said, in maternity care, increase access to primary care services, so doing that through a more flexible workforce, and improving access to cancer treatments. So we know that in parts of the system, people's access is not as good as it should be. So to have a look across the whole system, to think about, can we move some services a little bit that enable patients to have better access. So they're just a few examples of what difference it might make. We know that the area is subject to major growth. So we're expecting very substantial developments of housing across our west corridor. Particularly there's developments in Berkshire, Oxford, but also along the route between Aylesbury and Milton Keynes with new roads and railways and very large housing developments. So the question mark is how we're going to provide appropriate and targeted healthcare or social care to those new residents. So we need to think about ways of caring for people, as I've said, more in their own home and becoming more efficient. So I think so the workforce and the growth challenge. And I think the other thing is that people are busy in their own jobs, running their own organisations, and it's about ensuring that they come to something that's purposeful, that achieves some outcomes that are helpful to them rather than a talking shop. So I think it's a challenge to make sure that we stick to that agenda.